Hello, I'm Dr. Ruth Roberts, your pet's ally, and I hope you're well. I've got another support protocol to discuss with you, and then several questions and answers. So hopefully both of these will bring you information that you need for your pet. So first of all, what I'd like to talk about today is anxiety. And it is a growing problem in the United States, both in people and in their pets. So I'm going to jump into the members area. If you're not already a member of our free members area, you'd go to my website, drruthroberts.com, click on member login, and you'll see a link to go register for your free members area access. And I'll put that link in the comments below as well. Now, once you're already in, you will end up at your member area or my account page. And up here, you'll see the various courses we have available for sale. We've got a paid members area coming up, which I'll be very excited to talk with you about going forward. And then down here are the free holistic pet health resources. Got some videos, some PDFs, and then here are the holistic health protocols. So when you jump over there, you'll get this page that shows the various support protocols I've developed that are meant to be starting points for you and your pet. And so the one we're going to be talking about today is the anxiety support protocol. Now, it's worth noting that many issues can be solved simply by using the Keep My Pet Healthy protocol, which, where I discuss using home-cooked food, such as the original Crock Pet diet, and reducing inflammation with the diet, as well as a multivitamin and several other supplements. But let's jump into this anxiety support protocol. So we'll pop in over there. And so the main goals are to improve brain function, control inflammation, and support the gut. And I know I talk endlessly about supporting the gut, but in this situation, the reason is that the intestines, the bacteria in the intestines, I should say, produce something like 90% of our neurotransmitter. And if your pet's been on an extremely high carbohydrate diet, they're not getting the right neurotransmitters. And so this can make things like separation anxiety, reactivity to movement, other dogs, people, children, things of that nature, and noise phobias much, much worse. So part of our goal is going to be to improve the good bacteria in the gut by feeding lots of fibers that are found in whole vegetables and supporting normal brain function by providing a keto diet, which is a high-fat, low-carb type diet. It's been shown to improve things like Parkinson's, Alzheimer's, MS, and there's some evidence that it helps with anxiety and depression in humans. So I think it's worth exploring for your pet as long as your pet has not had any issues with pancreatitis. If that's the case, you want to approach a higher fat diet very, very carefully. Also, the liver's ability to detoxify gets improved by feeding the Crock Pet diet because you're feeding a high fiber diet, which helps physically move toxic elements out of the body, and then brassica veggies provide the phytonutrients that help your liver get rid of stuff that it should, and in this situation, excess neurotransmitters that could be sending the wrong signals to your pet's brain. So that's step one. The second step is to reduce inflammation and anxiety, and then support brain function. So these two in the center, Icosamax triglyceride formula, which is a high-dose omega-3 fatty acid supplement, and Therabiotics are my mainstay for almost every condition because we use probiotics to improve the quality and the quantity of the probiotic organisms in the gut. Again, these guys produce something like 90% of our neurotransmitters, and they account for almost 70% of our immune function. Now, the omega-3, omega-3 fatty acids are extremely important for so many things as far as controlling the inflammation, and in specific, in this situation, for improving inflammation within the brain. So there's a great deal of evidence that many of the diseases that we associate with brain dysfunction, whether that, again, is anxiety, impaired cognitive function, things of that nature, are related to increased inflammation present in the brain. So again, that's going to be really core. Now, liquid NutriCalm is a supplement I have used for years, and it is a tryptophan and theanine-based combination product. It's in a smoked salmon flavor, so it is not it's not actually salmon, but it tastes like it, so your pet thinks that's pretty delicious without any potential food sensitivity. So it's been fantastic. You can use this as a day-to-day supplement if you're introducing a new pet to your home from a shelter. If you've got a dog that's anxious, in general, you can use it every day. During thunderstorm season, that's been very helpful as well. And then known stressful events such as car rides, a storm rolling up, all of a sudden vet visits, that sort of thing. So it's been tremendously helpful. Again, our ingredients here are tryptophan, which kind of helps the neurotransmitters respond more appropriately within the brain itself, theanine, and ashwagandha, which is considered to be an herb that helps support sort of all levels, so an adaptogen type herb, and then catnip and some valerian. So this has been just wonderful for many, many pets. And then the last thing in this protocol is Free and Easy Wanderer. And this is a traditional Chinese herbal formula that is used to help support the liver in traditional Chinese medicine. And it does that by coursing the liver, reducing irascibility, which is a word I just love, and smoothing the flow of qi and blood in the body. So what that means in the real world is that it helps to improve irritability and anxiety, as well as improve the liver's ability to detoxify and support the digestive process. So you do want to start at the low end of the dose of this product and then gradually work your way up to the target dose. So these are the 4 components of the anxiety support protocol. Again, if you want to purchase the entire bundle, you'll save 10%. And then, as always, if you need some help sort of deciding what to do first, you can click here. There will be a little form you can fill out, and we'll get you a response back. If you need a much more detailed program for your pet, I do have these options available, and this includes going through your pet's medical records, what you've done already, what supplements you're using, what's worked, what hasn't worked, and then developing a complete plan to support you and your pet during this process, both with food, supplements, and then other things that your vet may be able to help you out with as well. So that is the anxiety support protocol. And let's see, there we go. Now I got me back. So there were several really awesome questions that came in this week that I want to answer for folks. The And if you have a question you want answered, message me. That's the best way to get a question over to us. If you go to the website and click the Ask Dr. Ruth button right on the home page, that's another way to get questions to us. So Sharon was asking about Ruby, who's a fox terrier who's not eating and is very sick and in the hospital with liver disease. And I didn't get very many other details, Sharon, but hopefully things are better and Ruby's out of the hospital. This liver disease can be very complex. And so certainly I do have a liver support protocol, which is a great starting point. But again, the basic ideas are to reduce inflammation in the body and assist the liver in getting rid of garbage. So, I would take this. You're going to have to see kind of what the diagnosis was for your poor Ruby, and hopefully this will get you some guidance to get her back on course. But in general, I think you're going to need to come back with a very bland diet. So maybe chicken and rice would be appropriate, things of that nature. And then add in some very basic liver support slowly. So things like milk thistle or liposomal glutathione, things of that nature. You want to go very slowly because we certainly don't want to make Ruby get sick again. And then Kim was asking about Maya, her Great Pyrenees, who has a disease called symmetrical leukoid oncodystrophy. And she's seen an improvement with nutrition and supplements and homeopathic meds, but the symptoms always come back. So for those of you that are not familiar with this disease, it is an autoimmune type disease, and basically it is a disease of the toenails, and there's a couple of variations on this. So one really important thing about Kim's question, it's not clear if you stop what you're doing as far as supplements and things of that nature, and things come back, or if the symptoms return while you're still doing those things. And so in practice, the things that were so important for my patients that were dealing with autoimmune disease is to first and foremost work on the gut. If the gut is very leaky and your dog's immune system is seeing the same food antigens every day and it's high carbohydrate, highly pro-inflammatory, you're going to be just banging your head against the wall. The other thing about autoimmune disease is it didn't develop overnight. It may have taken 6 months for the symptoms to develop, but it is a sign that your pet's immune system is way out of bounds and is overreacting to something, and as a result is attacking your dog's toenails. So you may have to make a commitment to lifelong types of therapy as far as food therapy, supplements, things of that nature. For many of my patients, we were able to get them off of many of the supplements, but we still needed to use high quality cooked food that was rotated often, along with some sort of a high dose omega-3 fatty acid and probiotics. So I hope that's helpful, Kim. And as far as the protocols I've got available, frankly, I would start with the gut gastrointestinal support protocol, because that's really where you're going to hit more of a home run there. And then Jay's asking about her dachshund, Dobby, who has an enlarged lymph node near the kidney and an enlarged pancreas and was in the hospital for 2 days, and evidently is a really tough one to medicate. So I'm guessing from your description that he has pancreatitis, and hopefully the lymph node enlargement near the kidney is just a reaction to the inflammation in the pancreas itself and not a separate issue. So certainly you're going to want to use a very bland diet, again, chicken and rice, to keep him eating, and gradually work him onto an anti-inflammatory diet like the original Crock-Pot diet. Now, the thing about pancreatitis, if this is indeed what's going on, is that for years my colleagues have said, oh, now you have to feed a low-fat diet for the rest of your dog's life. And that's not really true. What is true is that you do have to feed less fat than you were before. So the problem is we don't know exactly what that is. Is it 10% less? Is it 25% less? And so what I would do is, Again, if you go to the original crock-pot diet, use half the oil that's called for in the recipe, and then gradually work your way up. When you see your pet having, burping, gurgling noises, things of that nature, then that means you've gone too high. So as far as the other issues is getting medications into poor Dobby, you can try adding the medications to a very tiny amount of food, bland food, that he really loves, so that he eats the pill in the food right away and then he gets the rest of the meal. Some dogs are smarter than that, and certainly most cats are. You can also get the medication compounded into something that's a little bit tastier, so you can squirt that in the mouth. You can often compound medications sort of at home by crushing them and putting them in a tasty liquid like pancake syrup or maple syrup or honey or something of that nature. Obviously, that's not a great idea if your pet's diabetic, but you could also put it in, say, blenderized tuna water or something of that nature, and then use a syringe to get the medication down. So I hope that's helpful. The other thing that I've had to do as a last resort was actually resort to injectable medications that could be given under the skin, much like fluids. So I hope that is helpful, Jay, and that Dobby gets well and things go on easy. Let's see, Dee was asking about her Whippet Joey, who has elevated C6 antibodies, and this is a confirmatory test for Lyme disease. And Joey was given a 28-day course of doxycycline. And this is where I really have to agree with this course of action. Chronic Lyme disease can really be awful, and we are starting to see it in our dogs as well as in us. And so, the acute Lyme disease, and I think in this instance, Dee was not seeing any symptoms in her dog, and likely what happened is the vet tested sort of one of those screening tests. It came up positive, and then got a C6 test done. And it's hard to make sense of treating with a whole month worth of antibiotics. But in this situation, I think this is appropriate. And the reason is that with acute Lyme disease, you'll see discomfort, fever, things of that nature, but many pets are bypassing acute disease and just all of a sudden 3 to 4, 6 months later, they're showing up with heart disease, kidney disease, joint and other organ disease secondary to the chronic inflammation from the Lyme organism. So as far as what to do afterwards, I would clean up the gut after the antibiotics, and right now I would use, again, high-dose omega-3 fatty acids to help reduce inflammation in general. You can try to repopulate the gut to some degree by giving probiotics 2 hours away from an antibiotic dose. And then after the antibiotics have been finished, you can work on that gut support protocol and really renourish the gut and repair it. And in particular, the heartworm treatment is great for regrowing. Sorry, I said the wrong word. Heartburn TX product in the gut support protocol is excellent at helping to regrow normal cells in the intestines. And then the other thing you could consider both then and now is activated charcoal at least 30 minutes away from any supplement or medication to help absorb or adsorb any enterotoxins or any toxic products that are produced during this process. So I hope that's helpful, Dee. Aaron's asking about her golden rusty with hot spots. He's been taking antibiotics and steroids. As soon as the meds are done, they come back. And that's no surprise, Aaron. Again, part of the problem is the gut has just been whacked by all these medications. So you want to do a couple of things. One is I would get some sort of a test to look at what is rusty sensitive to. And you can do that with allergy testing through HESCA or food testing through NutriScan or Glacier Peak's Life Stress Scan. And frankly, again, that's been as good a roadmap as anything else. And then use that to help work on gut health. And this is where I would do a rotation and elimination diet to keep things working smoothly. So hope that's helpful. And then certainly, Aaron, this is where I can be of help as far as figuring out what a what a plan would be. So Jeanette is asking about her Morkie Monique, who's getting to be a real picky eater. She's been preparing food. I'm not sure exactly what you're preparing, but you do want to make sure you're using a balanced recipe like the original Crock-Pot diet. Check that there are no physical reasons for Monique to be picky about what she's eating, like an infected tooth or a whole bunch of teeth that are abscessed and painful, liver disease that might be creating nausea, some sort of gastrointestinal disease. So check that part out with your vet. Make sure there's not a physical reason for Monique not wanting to eat. And then if there isn't one, then start with a basic, I would start frankly with the basic cat recipe and kind of work your way back into adding various vegetables and things of that nature into the diet. And let's see, the last one I've got for you, Sherry is asking about her kitty Rosie, who's been getting urinary tract issues from more than twice a year and using antibiotics. So Sherry, cats are like women in this situation. When we get anxious, we often respond with bladder discomfort, and it often is not an infection. It is considered, often the diagnosis we get is something called interstitial cystitis, and same thing happens in cats. So the next time Rosie has an issue, you want to make sure that your vet's doing a urine culture and sensitivity to make sure that if there is bacteria present, that the appropriate antibiotic is being given. If there is not bacteria present, then I would try the other things I'm going to mention down below. There are some cats that just don't culture a bacteria out, but they respond to antibiotics. And there's two potential reasons here. One is that in traditional Chinese veterinary medicine, antibiotics are considered cooling. Bladder issues are considered bladder damp heat. So the other theory is that the number of bacteria present are insufficient, or they are buried deep in the mucosa of the bladder so that a positive culture does not develop. And that's why that's kind of what the internists use to explain why we give antibiotics sometimes to cats with negative cultures. Now, the other thing that's really important is that if this is stress or anxiety related, and if you can kind of make that match up, like you had to travel or you had to move or something of that nature, then there's a couple of things going on. One is it is possible for bacteria to move from the colon to the bladder and create an infection. This is called bacterial translocation. And then the second is that just that stress, the bladder becomes the target for the inflammation. So the things that are here are going to be crucial here would be to use something like D-mannose, which is a type of sugar that helps to dehydrate the bacteria in the bladder, like E. coli and Pasteurella multocida, that tend to attach to the bladder wall and create chronic infections. And it also seems to help reduce inflammation in the bladder wall itself. The other things are going to, again, be things like high doses of omega-3 fatty acids and high doses of probiotics. And this is for two reasons. One is that it helps to improve the neurotransmitter production so that the good ones are being transmitted to reduce stress and anxiety. And the second is that it will improve the quality of the anti-inflammatory compounds that are produced in the GI tract and prevent pathogens translocating or moving from the colon into the bladder. So I hope that's helpful for you. So Sherry, that anxiety protocol I went over a little bit a few minutes ago would be a good place to start as well. That's what I have for you this week. Hopefully Facebook will play along and allow me to upload this video, and if not, I will send you the YouTube link. Until next week, remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally.